Segment 3, Involving Emergency Services. While intervening with a suicidal individual, there may become instances in which involving emergency services is required. For instance, 1. If the individual has already done something harmful to themselves, it is time to call emergency services for active rescue. That individual may need to be transported to the hospital immediately to ensure their safety. Number 2. The individual has an immediate time frame for suicide. They may say something such as, "I'm going to suicide tonight," or "by tomorrow morning I will no longer be here." If suicidal individuals have an immediate time frame, this could put them at an immediate risk for suicide. This indicates that it is time to involve emergency services. 3. The individual refuses to safety plan despite attempts. If the individual is not able to create a safety plan in order to keep them safe, this suggests that if the thoughts of suicide return, they will not have a specific plan of action. This also indicates the need to involve emergency services. Involving emergency services allows for the police to check on the welfare of the individual at risk and transport them to the hospital if determined necessary. In order to involve emergency services, one must first contact their local police department and inform them that they want to initiate a wellness check for an individual who may be at risk for suicide. Tell the dispatcher all of the information about the individual at risk, such as the individual's address, last known location, general demographic information, mental health history, and if the individual has access to lethal means. Many communities have crisis intervention team programs, which are composed of police officers within the department who have received crisis intervention training. Not every local police department has an officer trained in CIT, but it is suggested that you ask for a CIT officer if possible. However, involving emergency services is not always necessary. Many individuals are simply just needing someone to talk to and are already capable of keeping themselves safe. It is your role to provide support and engage them in discussions about safety. Lastly, be sure to consult with your agency's policies and procedures to ensure that the correct plan of action is followed. Safety contract versus safety plan. In the past, when individuals would report thoughts of suicide, the clinical approach was to have that individual sign a safety contract. This is a written contract in which the client promises the clinician that they will not harm themselves or die by suicide. They would also have the client's promise to call professional help during crisis. The individual would oftentimes have to sign this agreement before leaving sessions. Safety contracts are no longer considered best practice in the mental health field, due to the research showing the overall ineffectiveness of the contracts at actually keeping clients safe. There is no empirical evidence that supports the use of a safety contract, and they do not provide adequate direction for the client when they are in times of crisis. Ensuring a client's safety requires more than just promising them to stay safe for a certain amount of time. It requires collaborative safety planning on behalf of the client and the therapist in order to develop a specific plan of action for what to do in the event of a crisis. Safety plans are now considered best practice, and empirical evidence suggests that this is an effective intervention for reducing suicide risk. Safety plans can be created in any setting, including schools, at home, hospitals, mental health agencies, and more.
Creating a safety plan. A safety plan is meant to be created collaboratively with a client and is strengths-based and empowering. When creating a safety plan, it is helpful for clinicians to approach the task assuming that clients have the ability to use skills and identify ways to stay safe. Safety plans can be empowering for clients who may need help recognizing that they may not always be able to control their suicidal thoughts, but do have options for how they react to these thoughts and what they do to help themselves. Safety planning can be used during a single intervention or used during ongoing treatment. Safety planning is not meant to be a replacement for therapy or other mental health services, but can certainly be used as a specific intervention throughout the use of these services. Safety plans are meant to be created in a short amount of time in an easy-to-read format and in the client's own words. When developing a safety plan with a client, it is likely to be helpful to explain the purpose of the safety plan and how it will help the client. For example, you may want to talk to clients about how thoughts of suicide often come and go for individuals, and having a plan in place of what they can do to help themselves when these thoughts happen can prevent future suicide attempts. Reducing the means. One of the most key parts of a safety plan is reducing access to means for suicide. Studies have shown that decreasing access to lethal means for suicide can reduce suicides. This can be done by making the means less accessible or making the means less deadly. Many suicide attempts are made impulsively during a short time period of crisis. SAMHSA reports that 25% of those aged 13 to 34 who almost died from suicide say that less than 5 minutes passed between the time they decided to kill themselves and an actual attempt. When means for suicide are not immediately accessible, individuals have more time to consider ambivalence about wanting to die and deciding to be safe. When discussing access to means, it is important to reduce access to any possible means for suicide. We know that access to lethal means in itself is a risk factor for suicide. However, we know that firearms are the most lethal method for suicide and therefore may require special attention. It is suggested that access to firearms be assessed for all clients experiencing suicidal ideation, regardless of whether they mention a firearm as a possible method for suicide. Firearms. The best way to keep someone safe from suicide with firearms is to remove the firearms from the individual's possession. You may suggest that they give their guns to a friend or family member who does not live in the house for a period of time. Some police departments may store firearms for periods of time and may also dispose of guns if your client decides that is the best option for them. Check into your local police department's policies so that you can educate your client on the options. There are times when clients do not feel comfortable moving firearms from their home for various reasons. In these cases, it may be a good idea to suggest safety measures such as cable locks, lock boxes, gun cases, and full-size gun safes. Assess whether a client would feel comfortable giving the key to someone else for a while until they feel they can be safe around firearms again. Make sure that you are engaging clients in a discussion about how they can make their environment safe, no matter what their potential method for suicide is. Sometimes this may require a level of creativity in situations when safety planning around means may not be easy. For example, when clients are considering overdosing on prescribed medications, rather than eliminating access to means, discuss how the client can reduce access to means to make their environment more safe. Questions to ask may be, can a friend or family member keep excess medication while you keep smaller necessary amounts? Can you talk to your doctor about writing prescriptions that need to be filled more often to avoid receiving too much medication at once? Can you keep your medication locked up at times when you do not need them? Asking questions such as these can also help you gauge whether your client is willing to work towards staying safe. To learn more about reducing access to means for suicide, we recommend the free online training titled Counseling on Access to Lethal Means, or CALM for short. This training can be found online at the Suicide Prevention Resource Center. The Stanley-Brown Safety Plan. Your agency may already have a safety plan template in place should you need to create one with your client. However, if you are in need of a template, consider using the Stanley-Brown Safety Planning Intervention. The Stanley-Brown Safety Planning Intervention has 6 steps that increase in level of intervention for your client. Clients are meant to follow the steps in order and proceed to the next step should the current one not help them effectively cope with their suicidal thoughts. Clients start by attempting to cope with their suicidal ideation on their own and then progress towards utilizing emergency care if needed. Although the steps are intended to be used in order, clients may move to a future step sooner in some situations. The safety plan has worked if it has helped the client's suicidal thoughts subside or the client feels their thoughts are manageable. Let's walk through the 6 steps. The first step is identifying warning signs that a crisis might be developing. Clients need to know when the safety plan should be used. Warning signs are a cue to clients that they may be entering a state of crisis and may begin to have suicidal thoughts. Warning signs are different for everyone, but may include thoughts, images, thinking processes, or behaviors. These experiences may become patterns over time and become easier to identify, and thus, clients can begin using their safety plan sooner. A good question to ask is, What do you experience when you start to think about suicide? The second step is determining internal coping strategies, or things that your client can do on their own to help cope with their suicidal thoughts. Coping skills may vary depending on the person, but can include activities such as relaxation techniques, engaging in hobbies, or activities that simply provide a distraction. It is a good idea to ask clients if there may be obstacles that could get in the way of them using coping skills, and then problem solve around these. If these skills do not work, the client should move on to the next step. The third step is listing people or environments that can provide a distraction. These social contacts do not necessarily have to be individuals that your client feels comfortable talking to about their crisis, but could simply be people that are enjoyable or distracting to be around. Social settings that involve being around others may be particularly helpful in staying safe. Assess the likelihood that your client will reach out to these supports or remove themselves from the environment they feel unsafe in. The fourth step to be used if the previous steps do not help the client's suicidal thoughts subside is reaching out to friends or family who can help. The social contacts listed in this step are people that your client could talk to about their crisis and share that they are experiencing suicidal thoughts. Ideally, have your clients list multiple people and prioritize the list. In this step, rehearsal and role play can be especially helpful so that the client feels as comfortable as possible reaching out for help. The fifth step is reaching out to mental health agencies and professionals for help. This is the step that would involve reaching out for emergency care. Have clients identify any mental health professionals they are working with and write down phone numbers. It is especially helpful if their mental health care providers have emergency numbers. Clients will also list a hospital they would be comfortable going to if they absolutely could not keep themselves safe, despite attempting to use the previous steps in this safety plan. The Stanley-Brown Safety Planning Intervention also includes the Lifeline Suicide Prevention Hotline as a resource for anyone. The final step is making the environment safe, which would involve safety planning around access to means. This step is helpful for anyone who has a potential method for suicide in mind. After completing the safety plan, discuss where the client will keep their safety plan. It will ideally be in an easily accessible place so that it can be used quickly when needed. There are some apps on mobile devices where clients can store their safety plan on their phones, such as the My3 app. Let your client know that their safety plan can be updated and revised at any time, and revisit the safety plan if you continue to work with them.